Hi, friends. Today, I want to talk about autoimmune diseases and increased digestive tract permeability, also old-fashioned term for that, leaky gut syndrome, because one of my subscribers asked me to do so. In front of you, abbreviated list of autoimmune conditions. Some of them will create, in some of them, the damage is created to connective tissues, psoriasis is a skin, joints, thyroid gland, skin, diabetes type 1 is pancreatic gland, and here is damage to the digestive tract. This slide I created to show you that there is a great discrepancy between what we read on medical websites and actually what we learn in medical school. On medical websites, you often read that cause of autoimmune disease is unknown, it's idiopathic. However, they will stress that it's problem of your own immune system. For some reason, the immune system starts to attack your own body. And that's the problem with the immune system. However, we went to medical school where we learned that immune system does not attack your own body because intrauterously, immune system is trained to recognize who is your own or self and what is the foreign non-self. All of our body cells carry a specific protein on their surface that help the immune system to recognize them as self. However, they will become non-self cells if they have a proteins or other substances on their surface that the body does not recognize, and we call it antigens. Antigens trigger the immune system to attack them, and this is very important, not only the antigen, but also the cells that will be attacked where this antigen is presented. So if this is the cell and the piece of something is added to the cell, the piece and the cell will be attacked. So what could be the piece? It could be virus, bacteria, fungus, or medical textbooks tell us something else. So I would like to concentrate on that, something else. And that's what I will be talking about, food and leaky gut syndrome. But I want to show you that it is not so if something foreign attached to the cell and cell get attached, it's not a problem with the immune system. It's a problem with either digestive tract or person get the virus. The immune system reacts absolutely correctly. It reacts on foreign substance. Now, before I go further for the explanation, I want to point to you that places of entrance of bacteria, virus, or foreign substances that call something else could be nose, mouth, lungs, eyelids, digestive tract, genitalia. Also, we may consider here vaccination because all the vaccines are made with the particles of bacteria and viruses. Now, viral diseases contribute to autoimmune disease. For example, here, MS, right? Look at here. It could be measles virus, varicella, Epstein-Barr, diabetes type 1, for example, myocarditis D virus. And here is, look at that. We have coronavirus. COVID-19 will create encephalomyelitis. That's probably why, by the way, this is my contact information. If people had coronavirus, they may have mental symptoms because virus get into the brain and will create inflammation there. When there is an inflammation, it means that immune system get there and it starts to attack not only the virus or part of the virus, but also cells of the brain. Clinically, it will be expressed as memory loss, inability to fall asleep or maintain sleep, could be anxiety, could be cloudiness of the mind. People may complain about forgetting things, numerous mental symptoms. Now, it does not mean at all if person has COVID-19 that it will have a mental or clinical symptoms of mental disease. Okay, some people have COVID and nothing, that's it. 3 days and they're healthy back. So what other factors could have affect genetic predisposition? We know that in certain groups, certain autoimmune conditions showed up again and again and again, generation after generation. All right. But we also notice that quite often our diet will affect autoimmune condition, right? For example, psoriasis, rosacea could become better if you change your diet. Also, ulcerative colitis could get better. So those something else items could be items, food items. For explanation, let's go to the blackboard. As always, I already pre-draw my favorite picture of the digestive tract. This is the mouth with the teeth. This is esophagus, low esophageal sphincter. This is the stomach, pylorus, small intestine, large intestine, and we go to the bathroom right here. When we put food in the mouth, we start to digest it, breaking down into smallest particles. So here is the smaller particle. In the stomach, it will go further. In small intestine, food get broken into such small parts that it will get absorbed through the digestive tract and will get to deliver it into the bloodstream. And this is our bloodstream, like that. And fully digested food parts will flow here and actually will go and build our cells. And here is the cells with the nucleus. So that's under normal circumstances. And by the way, the digestive tract is lined by the cells called enterocytes, and they are nice and square, and they are actually do not have any gaps whatsoever between them. Normally, when the food is fully digested, those are fully digested food, the part of the food, particles of the food will go here into enterocyte. And through the enterocyte will enter to the bloodstream. However, when there is an inflammation in the digestive tract, those cells, enterocytes, don't look that nice and square. They look like they're inflamed and unhappy. Not all the food in digestive tract is totally broken down into smaller particles. There are still big particles of the food floating here. As a result, during the if there is an inflammation in the digestive tract, this big part can go into the bloodstream and it will end up here. It does not belong here in the blood at all. So body will try to get rid of that. And trying to do so, it can, put into different tissues. And by the way, do not ask me why in some people, when there is this leaky gut syndrome or increased digestive tract permeability, so gaps get formed and food leaked here into the bloodstream. By the way, could be other items like viruses or particles of the viruses. Fungus can go here through the gaps, parts of bacteria, because bacteria is a normal, bacteria, different good and bad, live here in the digestive tract, can go into the bloodstream. So why in some people it's get deposited in one organ, in other person it will get deposited in a different. So we don't know. But let's think about it. Like suppose that in this particular person, this is the skin, and that undigested part of the particle of the food get deposited right here, and that's by definition is antigen. So immune system will look at that and say, hey, listen, it's a foreign particle here, and it will start to attack. Okay, and as it's attacking, it will attack not only this antigen, it will start to attack the cells of the skin. Clinically, it will be expressed on the surface of the skin as an inflammation. Inflammation. If you go to a dermatologist will give you some cream. It could be corticosteroid cream. You will suppress the inflammation. It will get, inflammation will subside. But as soon as you stop the cream, inflammation will come back because it's not the problem of immune system. And it's not the problem of the skin. It's the problem right here in the digestive tract. This is the food particles. This is in the medical textbook. Something could get into the, into our tissue and will make those tissues for the immune system to see as a foreign body. So, what your job is to think and experiment. Maybe if you will change diet, you will see decrease in symptoms. Okay, so now the question is, what can actually cause the inflammation in the digestive tract? The causes are numerous. It could be chemicals, herbicides, pesticides, drugs are chemicals too. Indeed, many years ago, when I was in the beginning of my medical career, there was an article on the PubMed that I cannot find right now about PPIs and increased digestive tract permeability, meaning that when people take PPIs, such as omeprazole, they will create this leaky gut syndrome. And at the end of the article, they stated that, yes, it could be a possible cause of autoimmune conditions because food particles, bacteria, viruses, or particles of the bacterial virus could leak from the digestive tract into the bloodstream. So, experiment with the food and see the most common offenders could be dairy, wheat, eggs, soy. So see what could be a possible cause. Eliminate drugs or decrease them drastically. See if it's possible, eliminate. Think about treating leaky gut syndrome, okay? And eat organic, if possible, okay? That's it for today, guys. If any questions, ask me right here. All relevant information in the description below. So all the necessary links. Thank you very much. Like, subscribe. Bye-bye for now.